Good afternoon. This is Alberta Brinson-Moore of the Wooten Center. I'm the health educator. And today we'll have COVID-19 post-vaccine questions and answers. Previously, we've had Dawnesha Beavers on, and she gave us some information, and so many things have kind of changed in the past couple of weeks in terms of being mandates for schools and mandates for businesses. So there are some additional questions. First, I would like to tell you a little bit about the Wooten Center. The Al Wooten Jr. Center is a nonprofit organized and founded by Myrtle Faye Rump in 1990 in honor of her son killed in a drive-by shooting. The center provides free after-school and summer programs for students in grades 3 to 12 in the South Los Angeles area. The Parent Power Group workshops are presented in partnerships with the Green Foundation and other donors, which can be found at the www.wootencenter.org/donors page. And today, our kind of memo from the CDC is staying up for your community by staying home, fighting to keep our family safe by doing your part. Doing your part to keep your family safe this fall. Make sure you wear your mask, get the flu shot, stay 6 feet apart, and wash your hands. And another part of being safe is eating healthy. And the eating healthy tip for the day is replace chips and dips with cherries and berries. That's our eating healthy tip for the day. So at this point, I will turn it over to Dawnesha Beavers, and she can give us, her information.
Good evening, everyone. This is Reverend Dawnesha Beaver, Program Manager for Kedron Vaccines. Please excuse me for not being on the screen this evening. We're actually coming to you live from Inglewood Unified School District at Highland Elementary School, where we've just completed a vaccination clinic for the school district. Kedron Vaccines has been delighted to partner with LAUSD as well as Inglewood Unified School District to complete vaccination clinics across 20 of their schools. And so we're here today finishing up, very excited about the numbers that we did today, just in terms of some of the community engagement. We've been really trying to hone in on best strategies and practices for this area. And so the team was very excited about today's results, and we're looking forward to continuing to work with Inglewood Unified School District as well as LAUSD and other partners. Specifically, we're starting to get a lot of requests come in from Catholic schools and charter schools and other entities and organizations who need infrastructure and support to support their COVID-19 testing and vaccination strategies. Since the last time we met, as you know, there was a huge announcement by Los Angeles Unified School District following the announcement from Culver City Unified School District that all eligible children 12 and over, must be vaccinated, including faculty and staff. And so we are moving forward in the direction to build up our strategies to encourage and support families. This is a very, very sensitive time in terms of our culture and our community. For those students who are elected not to be vaccinated and their families are electing for them not to be vaccinated, we do know that the strategy for them is to become independent learners. But what does that look like when you lose your teachers in contact with your friends that you've been in school with your whole life, right? So this is not just a matter of vaccination, but it's a matter of how we're going to engage the next generation of leaders in our communities through our schools. And so this is something for us to be really, really thinking about in terms of not just getting a shot in the arm, but what is the short and long-term impact that we're approaching. We also know that we are yet again approaching flu season. And so not only are COVID-19 vaccines available, but it's also time for people to get flus. We also know that a significant number of our children have not completed their school immunizations. And there is movement for those who are in kindergarten, first grade, second grade, sixth and eighth grade to have their immunizations completed by January of next year. So there's a lot of conversation, there's a lot of information that's happening. But the reason why we come to the Parent Power Group, and certainly thank you to Executive Director McSwain and Ms. Moore for their leadership and everybody on the call. But the reason why this group is so important, because this is a group where you can come to authentically ask your questions, to be accessible, and to help one another with the wealth of information. And when I say that there is a wealth of information that is going out, just most recently, I had the opportunity to participate in the Southern California conference of the AME Church 5th District meeting. And they're doing a series of panel discussions entitled Vaccinate or Not, the Crisis at Hand. And it's myself, as well as Dr. Amin Rogers from CDU, Marquis Barber from CDU, and Dr. Tracy Veal. And our young people are scared. I can say to you that most of their questions that they asked was really about dying, They had questions about the vaccine, but mainly they wanted to know if they did not get the vaccine, were they going to die? And we have to develop messaging that supports life, encourages life, and a life more abundantly, encourages them to not focus on dying, but focus on living. And this is an important message that parents have an opportunity to share with their students, to share with their children, to share with children in your village, is that you want them to focus on life. And the reason why we're doing what we're doing, the reason why we're out here encouraging people to be vaccinated, is because we're offering life-saving medication. I like to say it as such because it is life-saving medication to prevent hospitalizations and deaths from COVID-19, and to really help us get out of this pandemic that we have been in, not just locally, but we're in globally as well. Essentially, we thought we were going to be shifting and moving away from a pandemic to an endemic, but yet and still, we are still in this place because not enough people are still yet vaccinated. And so this is an important message that we want to get out. And there's a number of resources that are coming out to help families and parents. It's important to know just this week, the American Academy of Pediatricians launched a toolkit, and I'll place it in the chat, but they launched a COVID-19 vaccine confidence campaign just most recently to encourage, from a pediatric perspective, to encourage parents and to talk to parents and to help them learn how to talk with their children around COVID-19 and having COVID-19 vaccine confidence. What does that mean to be confident? That means to believe in something. That means to have the information and to have the right information. Not only do we want adults to be vaccine confident, but we also want our children to be vaccine confident. What does that mean? What is a vaccine? What is COVID? What is mRNA? What is a visceral vector virus? We want our children to fluidly be able to have conversations with their peers about this virus. And part of that is being vaccine confident and COVID-19 confident. It means having the right information and the right tools. And that information does not just come from the school-based setting, but it comes from the everyday encounters and everyday experiences that people have with their families and with their loved ones. So make sure that you check out the American Academy of Pediatrics COVID-19 Vaccine Confidence Toolkit. It is available. They have a PSA or a commercial, both in English and Spanish. They have a number of medical resources that are broken down at a very, very practical level so that you can engage with your children, engage with your peers, engage with those who you are around to encourage them in this space. Not only that, but there is also an amazing conversation that's happening in the space called Kids and the COVID Vaccines. W. Kamau Bell talks to pediatricians across the country to get updates and information. And this is also a media campaign. I'll share that resource. I'll forward that resource over to the team so they can share it with you guys in order for us, again, to have and be armed with the right information. There is so much misinformation. There's so much miscommunication, misdiagnosis, misappropriation when it comes to COVID-19, the vaccine, as well as what it means to know your status. And we want to encourage everyone, for those who are still really thinking about being vaccinated, if you're not vaccinated, make sure that you're being tested. You should know your status. You should be being tested weekly. And we do know that in some school districts that weekly testing is required, but we know in some school districts it's not required. And our children are not being tested. And so it's very, very, very important as parents that you speak up and that you advocate, that you ensure that the school for which your children attend has a COVID-19 guideline in practice. What is their notification process if a child was to be exposed to COVID-19? What's their absentee policy to make sure that there's not disadvantaged policies and strategies that impact certain children and certain demographics in certain cities and certain communities as relates to absenteeism from school? And so make sure that you are staying connected, make sure that you're staying committed, and make sure that you're staying informed about what's going on in terms of COVID-19. Just a few updates that I would like to share with you, and then I will open it up if there's any questions from anybody who is tuning in with us on today and they have any questions about something that is going on. But I just want to kind of give you a few COVID-19 vaccination progress updates to know that we are making strides. Yes, we have a lot of work to do, but I think it's also important to celebrate what we have done and where we have come so far. It's so easy to us to focus on the work that a lot of times when we're doing this work, we actually forget to celebrate the wins. We forget to celebrate the wins. And so here's just a few updates from the CDC as it pertains to COVID-19 vaccination progress in the United States. And so currently at this time, 209.7 million people have received at least one dose of any of the eligible vaccines that are available. 209.7 million people. 14.5 million people have been fully vaccinated with a single dose vaccine. So these are individuals who have been vaccinated with Johnson & Johnson. 164.5 million people have been fully vaccinated with a 2-dose series vaccine. And 179 people are fully vaccinated. So this is post 2-dose series vaccine with 2 weeks of additional time, and therefore a person is considered fully vaccinated. Also, it's important to know that 63% of the population to date has received at least one dose of the vaccine. But here's the gap, and this is why you and I are on this call. This is why we're out encouraging and promoting culturally responsive, culturally appropriate messaging, encouraging people to be vaccinated, because we're still only at 53.9% of people who are fully vaccinated. So yes, we have a lot to celebrate, but yes, we are still a significant number from achieving that herd immunity that we would like to see to get over to that 70% effort. And so we're doing the work. You're doing the work. You're doing a great job. This meeting, this gathering of the minds, of the spirits and the hearts to come together to strategize and form is a part of the work. And there's always going to be work to do, but I do want to strongly, strongly encourage you to not lose faint of heart, and to continue to focus on the work that you're doing. Some of the messaging that you can say, especially as parents, because as you know, children look up to their parents. Children desire to be affirmed and to be supported by their parents. And one of the biggest areas right now is there is a significant vaccination differential between children of color compared to white and Asian American children who are vaccinated. As we know, those children who are 12 to 17 in Los Angeles County only represent 20% of African American children, 20% of those who are vaccinated. And so then the question becomes, well, who are their parents? What age group do they fall in? Well, of course, they fall into the age group that's really struggling with the vaccine, which is that millennial group, right? The ones who are 16 to 40 that we're trying to really come up with appropriate messaging and communication strategies to encourage them to be vaccinated. We understand our medical traumas, we understand our racial traumas, we understand the social injustices that have occurred, and we want to be sensitive to those conversations. We want to be sensitive to those needs for those who have drawn back to their African spirituality roots in terms of how they perceive and how they practice medicine. Also, in being sensitive, we want to make sure that we're also being responsible and being engaged with the work that we're doing. And so some of the messaging that we have to continue to push and continue to share is that really the only way out of this pandemic is that enough people have to be vaccinated. Here in the United States, we no longer deal with yellow fever. We no longer deal with the Zika virus. We no longer deal with Ebola. We don't deal with a lot of conditions. We don't deal with polio. We don't deal with the Spanish flu, even that happened 100 years ago. And we do not deal with those things because of vaccines. And so it's important to come down to the root message that vaccines are immunity inducers. Vaccines are important to our way of life. Not just COVID-19, but they're literally important to our way of life, and they always have been. So it's important to know one of the things at a baseline message that you can communicate to your children, that you can communicate to your family members, that you can communicate to your friends, is that vaccines continue to be our path out of the pandemic. Also, vaccines protect our loved ones, and it keeps those that we love, most importantly, our children, it keeps them safe. And most importantly, it also protects our economy. You can look around your communities, you can look around your neighborhoods, and you can see there's some places that you used to go to all the time, and those places are no longer open because of COVID-19. You could look around a number of different places where things are not operating the way they used to operate because of COVID-19. And we want to get back to being a strong economy. We know that when there is economic disenfranchisement, we know who that impacts. And so again, this message of making sure that we're vaccinated just doesn't have physical effects or mental effects, but it has economic impact as well. It has economic impact when it comes to urban planning and urban development and investment and reinvestment and disinvestment from communities. And so it's very, very important that we promote this message that we also want to be healthy, but we'll be healthy in every single way possible. The next thing that we also want to support and encourage in our messaging is that the vaccine is free, that it is effective from reducing hospitalizations and death, and that it is safe. These are some of the most critical, most important words that you can say when you're communicating the message as it relates to vaccines. So what are some other additional updates that have occurred since you and I gathered just a couple of weeks ago? As you know, we are now in the process of also doing third doses for those who are immunocompromised. The CDC came out with 8 criteria that one can be assessed on in terms of severe immunocompromisation in order to be vaccinated. And we'll make sure that this group has that information as well. We're also looking at providing third doses to our seniors, our most vulnerable community as well, and making third doses available to them. Now we're starting to get a lot of questions about booster doses. When will they be available? How are they going to be disseminated? Do I get the same vaccine that I received before as a booster shot? And it's important for us to know that in Los Angeles County, we're still waiting on the clinical guidance that will guide how booster shots will be delivered here in Los Angeles County. Currently, right now, third doses are available. Third doses are available for the severely immunocompromised with 8 categories, going into how we administer those third dose boosters, and or if individuals, primary care physicians recommend they get a third dose based on their immunity compromisation. So it's important for us to know that first of all. And so if you're thinking about getting a third dose, or considering, know there's some clinical criteria that we're looking at in terms of ensuring that you are eligible and that you should be receiving a third dose. Because what the clinical research is showing is that the vaccine is still showing effective. It's still showing effective against the Delta variant. So we don't want to over medicate in terms of our vaccine strategy. So know that there is clinical guidelines as it relates to the vaccine offerings. When it comes to booster shots, there was this large announcement by our President Biden, that boosters will be available for the fully vaccinated beginning September 20th. However, as we know, we also have to look at how that rollout strategy is going to occur. So for Los Angeles County, that strategy is still being decided upon in terms of who will be available for booster shots and how that strategy is going to roll out. But as we proceed and we go forth and we're doing third doses, when you get a third dose, you're actually getting the same vaccine that you got before. We're not mixing vaccines. So a person who got Pfizer now gets Moderna, and a person who got Moderna now gets Pfizer, or vice versa with J&J. Right now, there is no clinical guidance as it relates to boosters for J&J. So for those who have J&J at this time, boosters or third dose offerings are not being offered to that category at this moment, while they're still going through the clinical research to guide us as it relates to that. And so that's also very, very, very important for us to know and for us to be mindful of. You also may hear that boosters may be available for those 6 months from their second dose or 8 months from their second dose. Again, all of that is being decided upon by our public health officials. And once that information is fully and readily available, you will see a complete campaign and rollout of the clinical practices for which all providers, including Kedron Vaccines, but all providers will be engaging with in order to make sure that you, again, are provided with a safe vaccine, with an equitable vaccine, something that you have access to, that you are engaged, that you are informed. So make sure that you stay connected with that information. You can always visit Los Angeles County Department of Public Health website. It's constantly being updated, and we're so grateful to the work of our public health department for the work and the amazing work that they're doing. You can always visit the Center for Disease Control and Prevention, and make sure that you are looking at credible sources. This is so important because so many people is getting misinformation because they're not going to credible sources. So anytime that you're looking for guidance when it comes to COVID-19 testing, vaccinations, information, make sure that you're getting that information from the Los Angeles County Department of Public Health, as well as those approved clinical providers who are providing you with the resources and services when it comes to testing and vaccines in Los Angeles County. This is very, 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 very important. Very, very important. So we definitely want to, again, encourage you to follow those things. At this time, I do want to open up the Zoom call if anyone has any questions for me. I know I shared a lot of updates. Make sure that your team will receive these links that they can forward out to everyone that's on this call. But are there any updates to any of the comments or information that has been said so far?
As you were talking, Dawnesha, I got a text from my son's school. We were notified of a positive COVID test today. We have taken immediate action. Please send your Donna, that's what they call him at Dorsey, to school tomorrow unless you have received a call asking your child to stay home. So that just came in.
Perfect. And we're starting to see this across the county, where you're starting to see people test and positive, especially. And one of the things why we're encouraging vaccines, because if you were to look at COVID-19 in the early stages of COVID-19, our children were at a very, very low rate of acquiring COVID-19. Children case rates were very, very low. It's not until we've gotten to the Delta variant, which is much more transmissible, which we're now seeing high cases of COVID-19 among children. We're also seeing hospitalizations, and we're also seeing death. And so this, again, is something to be very, very mindful of. We're very, very grateful for technology, right, to receive a text message of that sort. But again, this is something, even if you don't get a text message of the sort, you can still go as a family and be tested every week. Again, I want to promote the message of knowing your status, whether you're vaccinated or not. We are still seeing relatively low, but yet and still we are seeing breakthrough cases when it comes to people who are fully vaccinated and they are still contracting COVID-19. It's important to know that regardless of vaccination status, whether you can get the flu shot, it doesn't mean that you cannot get the flu. But what it does mean is that it prevents the long-term hospitalization and death that can come from not having any type of immunity within your system to fight. And so very, very grateful. I'm glad to hear that LAUSD technology is working, and those parent notifications through Daily Pass and various entities that have been involved are working. That's very, very important. But those messages can be very, very scary for families too. I have family members who received that message, and the message was a little bit different. It was like, you actually need to come pick up your child and take them to go get tested because they have been exposed, right? And so you're not getting a name, you don't know when they were exposed. So that can be a little bit scary for families as well. And so again, as parents, these are things to just be talking about, things to be mindful of how to encourage, how to prepare parents. If you were to receive that message, what's your strategy of communication to your child or to other family members? And when it's discovered that you need to go and you need to get tested. So there has to be strategies around that as well. So it's not just pressed upon people or surprises them, but that you have a strategy of engagement, even in your household, that you have a plan of action. What if you do if someone in your household is diagnosed with COVID-19? What's the quarantine strategy? What's your family engagement strategy with that individual until they come out of their quarantine time? So again, these are strategies and communications and tools that you actively have to be thinking about and actively need to be preparing for in your household.
Actually, speaking of the strategies, that's where I think myself and others have really, I'll use the word blatantly, fell out. I'm starting to realize when that message comes that maybe someone was like, was it in proximity?
Mm-hmm.
And then they have to stay home and quarantine.
Mm-hmm.
And so I've had a couple of families where they believe it's a curse. And so the child gets punished. I told you to stay away from all them kids. I told you not to do it. What is wrong with you? I've had some get the holy oil. I have some put them in the bathtub and have them soak. So it's starting to get interesting. So I like what you said, to develop some type of plan. At least that way it'll probably ease the frustration when it happens. I've had parents who keep all the kids home. If one child at a different school gets a notification, not a positive result, but say that they are in close proximity of someone, I forgot what the term is, but
Mm-hmm.
it's when they're in contact.
Yes. Mm-hmm.
They can, and so when they get that message, the parent basically say, no, all of you guys are staying home because you don't know if you gave it to them or not. And they go get tested, because they go to the little walk-in and get tested. And they're saying that it's negative, but then they're still punishing the kids. And so I like what you said, develop a strategy. And so maybe that's probably where I'll start now. Say,
Absolutely.
hey.
So you want to have, these are tools, right? And so equipping people of how to respond. I mean, we're in the natural world, right? I mean, really think about how much we were never designed to be alone. People are around people constantly, even when you try not to be. When you're even being the most safe, and one of the reasons why we promote vaccines is because no matter how much we try to be safe at 100% level, social distancing and face masks just won't do, right? And so this is one of the reasons, because that's all external protection. That's not internal protection. It can limit contact, but it does not get into the body and kind of work the body and help the body develop the immunities and the antibodies that it needs to fight. And so with that being said, it's very important to come up with tools. What are 5 tips or strategies that you can give a parent or to give a family member if you were to receive that text message? We don't want our children to be punished, right? We don't want our children to be punished for being their natural selves, for enjoying their friends and doing things that children do. But it's a scary time for them too. How do they engage with their friends, or the excitement they see? Because some people have been in isolation for quite some time. And so when they do get a chance to see their friends or see loved ones, they're more excited than they normally would be. Why? Because they haven't been around them. So what are the tools and the strategies of engagement when you engage a family member that you haven't seen in a long time, or maybe that you are around a granny or grandfather, and maybe you are not vaccinated? And if you're unvaccinated, there should be a strategy of engagement of how you engage with your family members, how you engage with your elders, how you engage with community members, because it's not your desire or your intention. However, you are considered at a higher risk when you are unvaccinated. And so there should be, instead of a shaming, there should be an engagement and a conversation of, when we go visit, this is what's going to happen. Or maybe we're going to stop by, but we're not going to go in the house. We're going to just stop by and we're going to be in the car and we're going to talk to granny, we're going to talk to grandfather from the car, so that you get a chance to see them. And so I think it's important, especially in this season, that we help maintain healthy relationships, but also that we also have healthy dialogue on how we engage with those who are in our lives. Are there any other questions?
I just want to make a comment. I was on a call yesterday with the Democratic Frontier Committee, and they were saying that there was, Mike Davis said there was 130 Black funeral directors that died during the COVID. And we know how important, these funeral homes are in our community. Wow, it just stopped me when I heard that.
Thank you, Danger Man, for that comment. But I heard somebody.
This is Alberta, getting used to just not greeting people like we're used to greeting people, because it's you, especially when you haven't seen folks for a while.
Sure.
It's your natural inclination to want to hug them. Sure. And so, some of my family members have been doing the Wakanda cross, or the bowing, to just kind of, you need to do something, but not be up in everyone's face. And even with kids, one of my girlfriends is a teacher, and she was saying to remind kids, you can't share food, at school. There's some things that they're so used to doing, but they have to stop doing.
Right. And that could be hard. That's a big adjustment, right? So we're talking about how we engage with one another. We're talking about what is our communal engagement, what's our relational engagement with one another, what's our cultural engagement with one another. And so when we're shifting these norms, and that's what it really is, it can be challenging. It can actually be shocking to actually shift norms and normal behaviors. And you go to shake somebody's hand and then they give you their elbow. That can be alarming for some people because they're used to you shaking. They're actually used to giving you a hug. And so sometimes people already feel some level of discomfort that you just want to shake their hand and not give them a hug. But then you move from the hand to an elbow or a hand wave, right? That can really pose some challenges. But again, it all goes to communication. It all goes to how you feel comfortable and how you want to engage at a colleague's church that I know, they actually, the children and the adults wear wristbands. They wear wristbands, and the wristbands delineate how people want to be engaged with. And so those who have a red wristband on do not want any touching contact. So you engage with them, you may just wave at them. And then the yellow is they're open to elbow bumps and handshakes. And then green means just give me a big hug, like, yes, I want you to touch me, right? But it was a non-verbal way of communicating how people want to get, because it can be kind of awkward when you go towards somebody and you want to shake their hand, or you're used to giving them a hug and they kind of step back from you, right? And they're not trying to disrespect you. It's by no intention. They're just trying to protect themselves, or they're trying to kind of figure out that new norm when they've been isolated from people and they haven't had to do that. And so part of this process is giving people grace to discover their norms and their strategies and their comfortability. Sometimes we're so poor, like, you haven't seen me, you better give me a hug. You haven't did this, you better do that. And that's not kind of respecting people's boundaries, and the fact that even though people look the same, they're not the same. We've all been through a pandemic and been through a crisis. And so the people who look the same actually have changed. They've changed mentally, they've changed physically, they've changed emotionally. Some people have changed spiritually. And so again, we cannot assume people are going to act a certain way because they used to act that way before. And I think that's important for us to note as well. Are there any other questions or comments? The school is being so gracious, but I know I'm going to have to leave their campus before I become a teacher to that.
My question was on boosters, but you pretty much covered that.
Mm-hmm.
And then, like the other lady, my school called last week. My son is in Redondo Beach Unified. So my school called last week and said, Ernest has been in close contact with another student who tested positive, but he does not need to stay home also. And then they said, has he been vaccinated? And I said, yes, he's had both doses. And they said, okay, can you immediately email us the proof, the vaccination proof? And then every day, which I understand it, we get emails every day saying one kid tested positive, 2 kids tested positive, or whatever, a teacher or whatever. I don't think it's been any teachers so far, but we get that communication every day. But my question that I do have regarding the boosters, you covered pretty much everything. The boosters, is that going to be like something ongoing? Is it going to be, if you have this information, is it going to be every year, every few months? Do you have any clue? You can wake up now.
That's a great question. That is still being clinically decided upon as we deal with COVID-19.
Okay.
So, for example, we've come to learn to live with the flu, right? So every year the flu shot is required. And that's because the flu has been mitigated to the point where we're not dealing with an outbreak or a pandemic of the flu, but the flu is something seasonally that occurs not just locally, but globally. You have flu seasons. And we know prior to that, the flu season also, a lot of people pass during flu season. So they're still working through the science to see if boosters for COVID-19. I do think that we should be prepared that this is something that we're going to be living with for some time. I'm not going to say that it's going to be for our entire lifetimes, but if you look at the history, every generation has faced some type of pandemic at some point that they had to process and they had to go through. And so I do believe that we need to prepare ourselves, prepare our families, that we will be dealing with COVID-19 for some time. Our goal is to mitigate it, to move it from a pandemic to an endemic, and then kind of continue to go down the chain where we can get back to those things that we perceive as normal. However, it's important to know that we'll never be normal again, right? Because our generation, our children have lived through COVID-19. Not only have they lived through George Floyd and other incidences, but we're literally living through and navigating something that's never passed our way before in our generation, in our time. Similar to if you was to go back 100 years in 1918 and how that community and how people had to live through the Spanish flu. And you would even see then they were wearing face masks, they were wearing gloves, people had to quarantine. So some of the things we actually can look back at history and learn some of the lessons of how to survive and how to navigate and how to even thrive in this spaces if we go back and look at our history books. But I would say just prepare yourself that we will be dealing with this for some time. Again, as long as we don't get to the place of that herd immunity, as long as we don't get to the place of having enough people vaccinated, the longer the virus is able to thrive and live, the more opportunity it has to mutate. Most recently, LA County just did a telebriefing because now the mu strand is in Los Angeles County with over 200 cases identified of the mu strand. And so again, viruses mutate and they thrive in host environments and individuals who are unvaccinated, and they have an opportunity, because anytime you're dealing with a virus, you're dealing with something that is specific, has a specific pattern of behavior, but it's also specific to the individual of how it's going to deal with that particular person and how it's going to mutate and how it's going to adjust. And so as people travel, as people engage, as people go to large spaces, you're going to continue to see community transmission. You're going to continue to see, we're going to continue to see mutations because again, there's just not enough people who are vaccinated. So that's our effort. That's our promotion. That's our PSA, is that we want to end the pandemic. In order to end the pandemic, we have to get to the place that we have enough people who are willing to love their neighbor and sacrifice and say, I'm willing to get this shot. And I may not like it, but sometimes I'm not doing it for myself. I'm doing it because for that neighbor who may get it and they experience extreme complications where I was just asymptomatic or symptomatic and I got over my symptoms in a few days, but my neighbor didn't make it. You know, we have to have that level of social responsibility in this season if we really want to make it out of this pandemic.
Yeah, and it's really hard when you're
Thank
hearing
you.
about, you know, two parents that are passing and leaving 3 and 4 and 5 kids. And so you're just praying, everybody, come on, can we just get it together?
And look at the World Health Organization. The number of orphans globally has increased by like 50%.
Yes.
So, you know, we saw this early cases, kind of the HIV and AIDS epidemic, and you saw the number of orphans increase globally due to people passing. But think about those families and think about those individuals who are not at their dinner tables with their loved ones, with their families. And so those cases have increased as well. The number of children without their parents or now are in single parent households has increased as well. So when we're thinking about family planning, family dynamics, school situations, institutions, not just locally, but globally, COVID-19 has had a systemic impact on family relations, school relations, and engagement as well. And is there, I can take one more question before I have to come off so I can let these phenomenal school staff members close this school where they make me teach a class tomorrow. But is there any other question for me?
Well, we truly appreciate you multitasking, handling us, and it definitely helps us, and it helps us pass the information on to other people. Our last recording, you know, set us some record numbers in terms of folks going back and listening to it. And this is definitely one that we want to encourage other people to listen, because we do record it and it'll be on the YouTube channel. So we thank you so much. And before we leave, I just want to tell the families about the Green Foundation. You know, we're talking about, you know, families that have so many needs, families that have lost people or even just sick. And the Green Foundation is definitely there and providing resources to those families. So if you need, or you know someone that needs COVID supports, the Green Foundation, the Los Angeles rep, if you want to take a screenshot of this, 323-229-3411, or email info@thegreenfoundation.net. So I know everyone has to go, and I totally appreciate Dawnesha, and we will definitely keep you up on things as they occur. And until next time, thank you very much for coming.
Thank you. Sorry I couldn't be on camera.
No problem whatsoever. We appreciate you being here and getting information and definitely passing on this information.
Can I see that other screen? I was in the middle of typing my information in my zip code.